So how do we diagnose T-cell lymphoma? And well, today's talk will focus on peripheral T-cell lymphoma. There is a different subgroup of T-cell lymphoma called cutaneous. They're much more different than peripheral, but we'll talk about peripheral T-cell lymphoma first. So peripheral T-cell lymphoma, as I said, the most important part is the histological, the diagnosis of subtype of T-cell lymphoma you have. So usually physicians, we start with a core needle biopsy. So it's a needle, but with a little bit bigger needle to get some parts of the lymph node out. But often enough, we actually need to do a surgery, a small surgery, to get one of the lymph node completely out in order to make the diagnosis. To me, this is the most important step to know what subtype of T-cell lymphoma you have. And that allows our expert hematopathologist to look at the cells, to look at their shapes, and add those special genomic markers or immunostem markers, protein markers that we needed to further the diagnosis. The second part, after we make the right diagnosis, we kind of trying to see what's the extent of the lymphoma. So we do bone marrow biopsy sometimes, and then we always do a PET scan, not a CT scan, to see the extent of the disease. And then sometimes we always perform, we try to perform the molecular test to look at what mutations are there. And lastly, once we get all those information, then we will stage the patient. And this is kind of important to understand. A lot of my peripheral T-cell lymphoma comes in advanced stage, like stage 3 or stage 4. And this is very different connotation when you look at solid tumor, right? In solid tumor, when we hear stage 4, it's incurable. Well, might not true in nowadays, but back before then, it was always stage 4 incurable. Then I have to live the disease for the rest of my life. In the lymphoma world, stage 4 means you're going to have a little bit more aggressive disease, but the goal, at least the initial goal, is always trying to cure those patients. And we do have long-term survival, even if we see a stage 4 disease. And that has something to do with your immune cells tend to just travel all over the place because that's the nature of their function for their body. So here is the staging. So you can see if it's just one area, then it's stage 1. If it's like both area above the diaphragm or below the diaphragm, then stage 2. If it's above and below the diaphragm, stage 3. If it involves organs like liver or bone marrow, we call it stage 4. But again, don't get don't get too much concerned and don't all start thinking about stage 4, I'm going to die. Don't. That's not the case for T-cell lymphoma.